Stop. Do you have a tilted pelvis? It is a postural deviation characterized by an excessive rotation of the pelvic bones in one or more of 4 directions. This past decade of working with hundreds of clients from around the world, one thing I have learned is just by correcting the pelvic tilt, more than half of your postural aches, pains and problems disappear. When you are in your resting posture, if you find yourself standing with your pelvis tilted back, your knees locked, your chest either forward or back, that's a possibility too, then you have a anterior pelvic tilt, right? A posterior tilt is when your pelvis rotates backwards, creating a little bit of a disconnection from your lower back and a shortening of your abdomen. Here, maybe you find yourself in your resting posture standing like this with your chest either out or in. And of course, there is the lateral pelvic tilt. Maybe when you're in your day-to-day life out and about, your feet are together. If your feet are together, you might be shifting your weight to one leg and then to the other leg. Maybe you only shift your weight to one leg. Maybe you like to keep your feet apart. Even there, maybe you're shifting to one side and to the other side. The pelvic tilts laterally. The leg that is not holding your weight is rotating inward at the thigh. It's rotating inward at the knee, at the ankle, and making your arches of the feet collapse onto the ground. So either way, you have one inactive leg when you're in a lateral pelvic tilt. You could have a lateral pelvic tilt and still keep your knees straight, but one would be internally rotated. That also creates a deviation. Tilted pelvis in your resting posture can have serious implications for your movement patterns, muscular imbalances, and increased risk of injuries in your lower body and in your spine. This is your invitation to bring in more mindfulness, more connectedness with your pelvis, knowing what is happening when you're not looking. After all, your pelvis is the foundation upon which your entire spinal column stands tall and your entire body rests all around. Your median axis needs a steady, stable base. If you're still here, my name is Disha and I teach you how to build a pain-free body and reclaim safety in movement and stillness.